Anshul Gupta. It is so great to have you here. I feel like we had just recorded for a summit here a couple weeks ago, and you got some big things coming up and doing all sorts of great things. But for everyone listening, I have Dr. Anshul Gupta here with me today. He does a lot with thyroid. So I always start out our shows with, I want to know about your story. Like what got you interested in really tackling this thyroid health issue? Because it's a big deal. I feel like so many, especially women, deal with thyroid issues. So welcome to the show.
Thank you so much for having me over here. It's a pleasure. You're sharing so much good information with each and every person. So I'm glad that I can share some information from my end towards your audience.
Thank you. So appreciate having
So
you here.
yes, so let's start with my story, right? So as you know, mentioned, each and every one of us has a story behind it. So my story starts after completing my family medicine residency. I was in a very busy private practice. Just a couple of years into my practice, I started having my own health issues. I was having this horrible stomach pain. The pain was so severe that sometimes I will double over and thought about going to the emergency room. But I knew the emergency room doctors could not do anything except for giving me pain medications because, like all the testing that I have done was already negative. I had no idea why I was having this pain. I started taking some medications, especially for acid reflux. They were not working. Then after the pain, the other symptoms also started happening. I was gaining this weight while I was not changing my diet or I was not changing, how I was exercising. I was so tired that I have to take a nap during the day just to complete my clinic. And then after the clinic, I was so brain foggy that I was like not able to focus or do anything at all. So I was only 32 years of age at the time, and I was so scared that what is going on with my body? It is not making sense. I thought I was not smart enough, so let me go to all these specialists. Maybe they can fix me. I went to specialist after specialist, did a lot of testing, endoscopies, ultrasounds, blood testing. Everything was negative. They had no idea what was going on, but each and every person was adding more and more medications. I was taking all the medications, still no change. I was so miserable and hopeless at the time. But then I came across functional medicine. So that made more sense to me because I was hearing stories about other patients who were in similar boat. So I was like, maybe, that has a solution. I got certified into functional medicine. I started looking into my own health. I found my own root cause and then I addressed the root cause. Within 1 month, my pain was completely gone. Within 6 months, I lost 40 pounds. I had more energy in my life than ever before. I even ran a 5K rugged maniac. And I was never an athlete in my whole life. So for me to complete a 5K was a very, very big thing. So, and I was off all medications. So that was a big aha moment for me. Like, within 6 months, my whole life can turn upside down. So this is something.
Mhm.
So then I started working at the Cleveland Clinic alongside Dr. Mark Hyman, at the Functional Medicine Center. And then what I started noticing was that a lot of thyroid folks were exactly in my same boat. They were all brain foggy. They were all tired. They were all gaining weight. They all had stomach issues. And plus, they were all taking medications which their physicians were giving it, but they're still not feeling better. So I was like, okay, wow, they have in my similar boat. So something is going on over here. So started researching thyroid in much more detail, especially Hashimoto's.
Mhm.
And that's where I made a protocol of my own. I implemented the protocol, saw phenomenal results. People were getting better. Their lab results were getting better. People are getting off medication. So I was like, I need to share it with people around.
Yes.
And that's where I started this journey of sharing all this information to all the thyroid patients.
I love it. So let's deep dive in for people that are not familiar with thyroid issues, right? Hypothyroid is when the thyroid is working low, but then there's also an autoimmune condition of that, which is Hashimoto's, which is what we're going to deep dive into today. So there are, I mean, do you have the statistics for like the percentage of women that deal with thyroid? I've seen upwards of 80% that have hypo issues at some point. And I'm like, this is, I mean, and again, it's whatever study you can find anything on the internet,
Right.
right?
That's
But,
true.
like I really feel like there's almost an epidemic of thyroid issues right now, and we could go through all the reasons why. But let's hear about what are some of the symptoms of Hashi, and then what is your protocol? Like I do want to hear this because I think everybody listening is familiar with my story, the same sort of thing. Like I ended up with this Hashi diagnosis a little while ago, and it was like, this totally threw me for a loop because it's not what I expected. And then to sit there and think of like, wow, my body's attacking itself. Why?
Exactly. And you pointed out the correctly is that, it's an epidemic, like again, when we were doing the summit, like when we were talking about it, each and every person I was interviewing, when I will ask them, do you have Hashi or thyroid? And they will say yes. And I had completely no idea before I was interviewing them. So it's such a big thing which is happening, and, like nobody's paying attention to it.
Mm-mm.
So, what is Hashimoto's? Hashimoto's is basically an autoimmune condition of your thyroid gland where your body is producing antibodies, which is causing this complete havoc on your whole body. Now, a lot of people, like the only treatment option for the conventional medicine is that, well, your thyroid hormones are low, so let's give you some levothyroxine or thyroid replacement, and everything should be fine. Now, research says that 60% of people who are on medications do not feel better. That's a big number, and obviously we know that number is even higher. So the reason behind that's what I was looking why these females are not getting better. So what I found was that like the actual problem is that there is another organelle in our body which is called mitochondria. So these antibodies do not only destroy the thyroid, but they also actually start destroying this mitochondria at the same time. Now, what is mitochondria? Mitochondria is a powerhouse of the cell. It is basically responsible for producing energy. Now, this is what we know for a long amount of time, but the new research suggests that mitochondria is not only the powerhouse of the cell, it is responsible for controlling inflammation in your body. It is an anti-aging, organ, in our body. It is responsible for brain health. It is responsible for, fertility issues. So a lot of all the problems and all the symptoms that actually Hashimoto's patients go through are symptoms of destruction of the mitochondria. Now, there is a small connection that happens between thyroid and mitochondria. This connection can be compared to what we call as a gas pedal and an engine in a car. So your gas pedal is your thyroid and your engine is your mitochondria. So in a good working condition, when you push the gas pedal, your engine starts producing more power, your car goes fast, and you are fine with it. When people have Hashimoto's, then their thyroid and mitochondria are destroyed. When we give them thyroid hormone replacement, we are pushing that gas pedal, but we are not doing anything for the engine. And that's the reason the car doesn't go fast. And we keep pushing more and more on the gas pedal, but nothing happens. So that is exactly the reason that we need to not only fix the thyroid, but we have to improve this connection between the thyroid and the mitochondria. And then only people with Hashimoto's get better.
So how do you address that with the mitochondria? Because I feel as if I love this. I love that you're digging in with that because um, it's been the last 5 years. There's a lot more people talking about mitochondrial health. And so I love that you're looking at that. So how do you address that?
So first of all, actually, we need to find what is causing the destruction of the mitochondria. So that's where the root causes happens. So, I've divided these root causes into 5 different categories. So first is food sensitivities. There are certain foods, which are mitochondrial killers, like gluten, dairy, sugar, processed food, soy, corn, all of those things we know that kill the mitochondria. So certainly, first we need to remove those food sensitive foods. The second thing, is stress. Like stress is the biggest killer of mitochondria because stress raises the cortisol levels. Cortisol levels, when it is high for a long amount of time, sends negative signal to the mitochondria, and the mitochondria, destruction starts happening. So stress is the second reason. Now, the stress can be anything. It can be physical stress, it can be emotional stress, psychological stress. Even pregnancy is a stress. So that's the reason a lot of females after delivering their babies do get Hashimoto's because they have gone through such a big stressful state. The second stressful state is menopause. Again, a big shift is happening in females' body during their time. So again, a lot of females around their perimenopausal or menopausal period get diagnosed with Hashimoto's. So that's the second big condition is stress. The third is toxins. Our environment today is laden with toxins, heavy metals, mold toxins, or environmental toxins, all the spraying we are doing. And we know that thyroid gland is like a sponge. And mitochondria is the most sensitive organelle in our body to toxins. So all the toxins destroy the mitochondria, again, kind of leads to Hashimoto's. The next is nutritional deficiencies. Now, there was a research study done which actually checked the amount of nutrients from 1990s to 2020. And what dramatically they saw was that our crops currently, our food currently is actually being deficient into a lot of vitamins and minerals naturally. So even though we are eating healthy diet, but our body is not getting the nutrients that it's supposed to get. So that's the first cause. That's the fourth cause. The last cause is infections. We know about Epstein-Barr virus infection, which causes Hashimoto's, again kills the mitochondria. And we now know Epstein-Barr virus can cause more and more autoimmune conditions. So that causes it. Then we have other viral infections, we have parasites which are causing it, then Lyme disease, Bartonella, Babesia. All of those infections again kind of lead to mitochondrial death. So these are the big five categories of the root causes. So first we need to identify in which person what root causes are there. And most people actually stop at one root cause. And the reason they do not get better is that they have multiple root causes going on. And that's the reason, they don't get better. So
What
first,
about,
identify the root cause.
sorry, go ahead.
So
What
that is
about
important, right?
molds?
Identifying all the root causes that is present in a person, so that we know what we're dealing with.
How I'm assuming mold plays a big role in this too.
Absolutely, yes. I'm identifying more and more people have mold toxins, and again, for some reason, again, the mold toxins directly attack the thyroid and the mitochondria. We have very little amount of research on the mold, especially not with thyroid. Just we know that the people who have been exposed to the mold infested building, their thyroid numbers are off. We just know that. Okay, we don't know how and why. That the mitochondrial killer definitely is the mold. So like we have so many mold issues with people who have mitochondrial problems. So mold is a bigger issue. Yes.
Yeah, for sure. And even if it was decades ago, I feel like I see that so often with clients when I start digging and I'm like, when did X, Y, and Z symptoms start? Where were you living at the time? What was happening? And they're always like, it's funny, you're the first person to put these things together. Like I've always thought that X, Y, and Z had something to do with it or whatever it is. All right. So how do you fix these people? What is you have a 3-step process, correct?
Right. So the 3-step process, the very first process is actually identifying their root cause. So we already covered the step 1. Now the second step is start fixing the thyroid and the mitochondria. So the first thing we do in that is that we have developed this mitothyroid diet. In that diet, again, we focus on removing the food which are causing the problem and introducing the food which helps both the thyroid and the mitochondria. So that's the mitothyroid diet. Then we have certain supplements or certain things we do to improve both thyroid and mitochondria. So certain supplements like selenium, zinc, magnesium are good for both thyroid and mitochondria. And some of the more specific mitochondrial supplements are coenzyme Q10. Then we use some NAD, in some of our folks. And then, acetyl L-carnitine and alpha lipoic acid. So a mixture of all those things we use to kind of support the mitochondrial health. So that's
Okay,
the second step.
You use NAC or acetyl. Which did you just say with carnitine? You're using N-acetylcarnitine, yeah?
Yes, N-acetylcarnitine, yes.
Okay, cool. Sweet. And then, I'm sorry, what was your third one? I was like, oh, I heard you say carnitine. I was like, wait a minute, you say NAC or just carnitine?
No, yes, and that's N-acetylcarnitine. And the third step is removing the toxicities.
Oh,
So
good.
the toxicities are again stress, is a toxicity. The second toxicity is obviously the toxins, and the third toxicity is the infection. So we work around all those toxicities, removing them, so that we can have, a long-term relief, or long-term improvement of, the Hashimoto's.
And I feel like, especially after what we have gone through as a world over the last 2 years with the stress levels, you spoke about pregnancy, you spoke about menopause, but then, hey, guess what? When people were watching the news the last 2 years, that's a stressor. I mean, it was putting them in fight or flight mode, and that's not cool. So, I mean, my number one thing I always tell people is turn off the news. Like, just turn off the news. So, all right. How about I want to ask you about peptides because these are my new little thing that I've been playing around with for the last few months. So, if you can, I've had a couple of people on where we've talked about peptides for skin health and a lot with men's health. But let's talk about peptides. Fill us all in exactly what are peptides, and I want to know how you're using them because this is some cool stuff.
Yeah, peptides is kind of those new age things, like I think we are going to use them more and more in the next coming years because there is a lot of research happening around with them. So what are peptides? So basically peptides are again a small collection of amino acids which are naturally produced by our body. Now, these are similar to proteins. Proteins are a collection of longer chain of amino acids and peptides are smaller chain of amino acids. The most common peptide that everybody has heard about is insulin. So we have known about insulin for several decades now. We're using it as a medicine. Obviously, it's life changing and life, producing for a lot of folks. But the new research has actually given us a lot of other peptides which can use in a therapeutic fashion. So initially the peptides came in and they were used, for men's health, for some weight loss, and for obviously people who are going to the gym and, like trying to build up some muscle. But now they're actually peptides which can be used for inflammation and also for autoimmune conditions, especially in Hashimoto's. So let's talk about some of these peptides and how they can be useful for Hashimoto's patients. So the very first peptide that I use for Hashimoto's patients is called TA1 or thymosin alpha 1. Now, thymosin alpha 1 is an anti inflammatory peptide. So, this TA1 is actually naturally produced by our body by a gland called thymus gland. So, we have this thymus gland when we are born as a kid. Thymus gland is responsible for creating our whole immune system. It basically trains all the B cells and the T cells in our body and then mature them into those cells which can fight off all the infections and also keep the inflammation at bay. Now, as we grow older, the thymus gland goes away, and then like it is assumed that our B and T cells will be smart enough to do their thing. But we know that in autoimmune conditions, these immune cells basically turn against our own body. So it's a total chaos. It's total inflammatory condition. So TA1 actually retrains these immune cells to start kind of behaving again and reduces the inflammation. So that's what TA1 does. So it reduces inflammation. It also helps with fighting off infections because it is obviously producing the immunity, which is good for hidden infections. Now we have again Epstein-Barr virus infections or other viral infections, which a lot of people go through, but they never recover from them completely. So TA1, helps to fight off those things. The third thing TA1 is actually very, very helpful is people, especially who have histamine intolerances. Several people with Hashimoto's have histamine or mast cell issues. Now, TA1, again, what it does is that it reduces the release of histamine from the mast cell disorders. So that, people who are super sensitive, that even one pill or even one supplement they put in their mouth and they start breaking out or cannot do anything. Sometimes when we use a TA1 before for them, they're able to tolerate things after that. The last thing T1 is very useful is something called CIRS, which is CIRS, chronic inflammatory response syndrome. Again, we see CIRS condition in people who have mold toxins or especially with Lyme disease. Very common condition again in Hashimoto's patients. So again, T1 basically when it is working on the immune system on the backgrounds, it helps to improve the CIRS condition and can support treatment of mold as well as a Lyme disease. So that's where this T1 is very useful.
So do you do these with injections or are you using those with capsules?
So T1 unfortunately comes with injections only. It is not yet available in the capsules. So we have to get them. But the injections are very good, because they are only subcutaneous injections. So these are like insulin shots that a lot of people do it on the daily basis. They do not hurt. The needle is very teeny tiny. Yes, every time I talk to my clients about, okay, well, it's going to be a shot, everybody freaks out. But each and every person, once they do the first shot, they said, well, this was so easy. It did not even hurt. So
Right.
it is very easy to do, but yes, it is a shot.
Yeah, there's a couple that I found with BPC 157, right? So I was taking that as a capsule, but then I was like, oh, maybe if I inject, like just sitting there, I use my body as a lab, right? Trying to figure
Oh,
out.
yeah.
So I always experiment on myself first. Do you use other peptides for thyroid?
Yes. So you mentioned the second peptide I use most frequently is BPC.
Yeah.
So BPC again is a very wonderful peptide, again naturally produced by a GI tract. It is good for like healing purposes, especially people who have a lot of ligamentous or muscular issues or joint problems, which a lot of thyroid patients have it. Especially chronic pain issues or joint pains or just feeling inflamed in their body. So BPC again is wonderful. The second benefit of BPC again is that it works in the gut. Again, we know that the leaky gut, is a big problem in Hashimoto's patients. So BPC helps with the leaky gut issues. The second thing is that, a lot of Hashimoto's patients have candidal overgrowth or bacterial overgrowth like SIBO or SIFO. Again, BPC improving the local gut immunity in the gut. It helps, to get rid of the candida as well as fighting off the SIBO. So it is a very good adjunct, in treating the leaky gut, reducing inflammation, reducing pain in the body. So it is great with that. Now, kind of mentioned an important point. The BPC does come in the capsule form. So what is the difference, right, between an injectable and the capsule form? So the capsule form is very great, if you want to do the local effect in the GI tract, for like inflammation, leaky gut, acid reflux, SIBO, SIFO, it is great for that. It is not one of the best things if you are looking for muscular health. So the oral form. So if you have ligamentous injury or muscular injury, or if you are recovering from a surgery, in fact, then injectable BPC shows maybe like 20% more benefit as compared to the oral one. Oral one still works, but injectable works, in that situation a little bit better.
And you can put it right at that area, right? Like that's what's typically
That's true.
like if you've got an injury, then you can focus on the injury. Like I go through a lot of the the male bloggers that I always complained about in the past that got me into my health issues. You've heard that on your summit. I still follow them for all of the peptides because it's the guys that are all messing around with the peptides, and they have been
Oh,
messing
yeah.
around with the peptides for a while. All right, cool. But anything else that you use? There's a couple for
Yes.
weight loss. We know that. Do you ever do that with for Hashi or no?
Yeah, so there are a couple of ones like CJC and epimorelin. That's the combination that a lot of people use for the weight loss. These are basically what we call as growth hormone, stimulating peptides.
Mhm.
So initially peptides were growth hormones. Then we saw that okay, growth hormone was actually causing a lot of issues, or potentially there was a concern about it. So now we have this CJC and epimorelin, which are not growth hormones, but they kind of indirectly helps the production of growth hormone. Now, what happens is that as we age, especially after 30 years of age, the levels of growth hormone naturally are going down. So that's the reason a lot of females, in their 30s and 40s, do gain a lot of weight, right? Which is Hashimoto's patients. So CJC and epimorelin can helpful, especially for the fat loss. So that's what we can use them. Now, the other way they actually work is that they actually improve the quality of your sleep. If you take them in the night, they improve the quality of the sleep. And what we have seen is that good quality sleep is actually important for weight loss. So by improving the quality of the sleep, they indirectly help with the weight loss because they can lower the cortisol levels, as well as the melatonin is increased in your body, and again that helps overall health and also improving with the weight loss. Now the results are mixed. I will say I'm not saying that those are magical peptide that as soon as you take CGCME Morlin, everybody is like shedding 40 or 50 pounds. I think we do still have to follow the lifestyle. So
Oh,
we still have to follow the
absolutely.
diet and the exercising piece. Then only it's going to work.
And so often I feel, especially with Hashi, like you have to eliminate gluten. It's not a like maybe you should take out gluten. Like you've got to get that out of your diet. And so it's one of those things like I hadn't had gluten for 20 years. So it was so funny. Like when my people looked at my numbers, they're like, you eating gluten? I'm like, oh, I haven't had gluten in a long time. Like there's got to be another factor here. So, but it is like the peptides and all of this are instruments in helping us achieve that health, but you've still got to you got to do the groundwork. So I'm glad that you are going through all those root causes with people to really help them truly heal. And you're giving people hope that this Hashi diagnosis is not like, you don't have to stick with this forever. You can go put that into like quote unquote remission or just get rid of it. I hate the term remission too, but like you can actually correct yourself. You can actually heal yourself.
Right. So there are actually two more peptides that like I would like to mention over here. The two peptides are Cmax and Clank. Now a lot of Hashimoto's patients, do come with issue with brain fog or anxiety or depression, right? And Clank and Cmax are nootropic peptides. Basically, again, they work on the brain. They have shown to be actually beneficial in some cases of Alzheimer's and dementia also. But they can improve anxiety, they can improve depression. A lot of people are taking these SSRIs, benzos, and other medications, and they're habit forming medications. That's the first thing. The second thing is that obviously there are a lot of side effects to these peptides. They are not habit forming, and obviously they don't have any side effects. So that's a good thing about it. A lot of again have Hashi patients have brain fog and also ADHD symptoms. Again, they're taking ADHD medications just to kind of function. And these peptides again can be helpful for improving concentration, improving the quality of their functioning of the brain. So again, these are again two peptides which a lot of people don't know about and can be very, very useful to a lot of Hashimoto's patients.
I love it. And especially when you think of like the SSRIs, like sometimes like the weight gain is a side effect, right? Like, I mean, that's like the least of the side effects. So, all right, Dr. Gupta, anything else you want to share with them?
Yeah, so from the peptide standpoint, the one thing I want to kind of share with also people is that, everybody is scared about the peptide, but the good part about peptide is that research shows that they're really, really very safe.
Mm-hmm.
Because I don't want to use anything unless I'm 100% sure that, there are no side effects to the peptides. And that is the best thing about the peptide. There are no side effects to it. Yes, like when you're using them, you should be working with a person who knows how to use them, along with other things, but they can be helpful in your situation. But along with the peptides, there are so many supplements which are good, which we spoke about. So if you look at your root causes, figure out first of all what all root causes you have, and then you start addressing them one at a time. then definitely you are going to feel better.
Yeah, and definitely finding a functional practitioner to help you along with us. Let's actually, do you still have a few minutes? Can we talk about labs with us, with people? And
Absolutely.
let's do, because I think this is classic. This week I was talking to somebody and I was like, well, if you're getting your, like they can just get their labs done with their medical doctor. So I was like, just have them do reverse T3. So the response came back, no, we're not going to do, I mean, we could do that, but this is really like, if you're dying, we do that. And it's so expensive of a lab and we just shouldn't do it. And I was like, time out. So let's explain why functional practitioners look at that reverse T3, why it's so important in that number in having, and like you said it, typically what happens, somebody gets a thyroid diagnosis, they get their hypothyroid diagnosis, whether it's Hashi or hypo, they're thrown on Synthroid, their TSH and their T4 numbers show up okay. And then, however, they're still fat, they're still exhausted, they're still constipated, like got all of the issues of low thyroid, but their numbers, quote unquote, are okay. That's typical medicine. It's just how it is.
That is true. First of all, not all people get the complete thyroid panel. So that's first thing that everybody should be getting.
Yeah.
TSH, free T3, free T4.
Yes.
And then the antibody levels. A lot of times, again, what happens is that the practitioner will order antibody levels once and they will not follow it along. Oh, well, we don't have to. Well, why not? Because these antibodies are destroying your thyroid gland. So I would like to know whether they're going up or down, right? If I can do something to bring them down, why not? But according to conventional medicine, they never go down. So that's the reason they don't check it, because it just creates more anxiety in folks when they're seeing it up and they're going to answer, then they have to answer that question, which they cannot. Mm-hmm. So make sure you're checking your antibodies, and then is this big reverse T3 problem, right? Because majority of the labs, still are struggling to do reverse T3. Practitioners have no idea what reverse T3 is and how to use the values. That is the bottom line to it. So let's understand what reverse T3 is. So T3 is, let's understand how thyroid hormone works. So the TSH is the basically, like the pre-thyroid hormone, which is produced by your pituitary, that goes to your thyroid gland, lets your thyroid gland produce the thyroid hormone, which is formed in T4. Now, T4 is an inactive thyroid hormone, which needs to be converted into the active form of the thyroid hormone, which is the T3, which generally happens, in the peripheral, in the different organs and tissues of your body. Now, what we are actually knowing about is that along with this T3, there is a counter hormone which is also being produced, which is called reverse T3. So you can compare that, if T3 is your gas pedal, as we shared before, then reverse T3 is your brake pedal. So it doesn't matter how much T3 you are, if your brake pedal is too high, it is not going to let the T3 function properly. So that's again a big issue that we see a lot of our patients, is that their numbers are perfectly fine, they're not feeling good, and boom, we check the reverse T3 and the numbers are super high. Mm-hmm. And we say, okay, bingo, that's where your problem is. You're not converting into T3, but you're actually converting to reverse T3, and that's the reason you're not feeling good.
Yeah. All right, I love it. Where can they find more information about you?
Well, I have multiple places, so I have a YouTube channel, Anshul Gupta MD, so they can follow me over there, share a lot of good information. I have a lot of research-based blogs on my website, which is anshulguptamd.com. I do have a book on Hashimoto's, which is called Reversing Hashimoto's. So they can go and buy it on Amazon. That's where I talk about all this 3-step process, which people can utilize to actually help them to understand what is going on with them and reverse their condition.
Awesome. Well, thank you so much for your time today. This was so informative.
Thank you so much for having me over here. And I'm glad that I was able to share some information.